And thanks so much, everybody, for attending today's Journal Club. I'm really excited to have my internal medicine specialty intern, Dr. Courtney Wright, present today. She has been with us this whole year, and she's going to UC Davis to start her medicine residency in a very short amount of time. And she was kind enough to volunteered to present for Journal Club, and she very kindly said yes, and I'm really excited for it. So Courtney, go ahead and
Yeah, thanks JD for the introduction. So I'm really excited to speak with everyone today for Journal Club. I've certainly learned a lot from previous Journal Clubs, so super happy to be chatting with you all today. And as JD had sent in the past, this is the article that we'll be reviewing today. It's a recently published article that came out in Journal of Feline Medicine and Surgery earlier in 2021, coming from collaboration with North Carolina State and The Ohio State University. And it's a diet that's specifically looking at a blue buffalo diet for dissolving struvite stones in cats. Now we can advance. So just a little general outline for today before we get into the article. I kind of just wanted to take a moment to review blue buffalo veterinary prescription foods in general. I felt like I didn't know a ton about them going into looking at this article, so just kind of briefly touching on what they have and just some food for thought, I guess, like pun intended. And then we'll take a brief detour just talking about urolithiasis review, specifically just struvite urolithiasis and management strategies for feline patients, and then we'll talk about the paper as well, and then there'll be time for discussion at the end. So first, starting off with the blue buffalo prescription diets, there's quite a few different diets that they actually have to offer on like a veterinary prescription level, some for hydrolyzed diets, a GI-friendly diet like GI low-fat, that sort of thing, a prescription kidney diet, a novel protein that uses alligator, which is unique compared to some other companies. They have a weight loss diet as well as a weight loss and urinary diet, which is the diet that this study looked at. It's really cool because Blue Buffalo has what's called True Blue Vets Community, and in full disclosure, I'm not affiliated with them at all, but I just think it was a really neat website and option for vets to join. And I did join it for the purpose of this lecture, just to learn more about the company in general. And what's really nice is that of all the diets they have to offer for the prescription diets, they have these like clinical reports that encompass kind of the target, the disease in general that the diet's trying to target and help manage. And then most of the diets have at least some kind of clinical trial to substantiate their use, or at least show that they are indeed good for maintenance in patients through either AAFCO guidelines, or they have been formulated to meet the specific AAFCO guidelines as well. And then something that just I kind of stumbled upon too that I thought was important to note is that nearly all of the diets are grain-free, and none of them contain corn, wheat, or soy. The only diet I could find that had grains in them was the kibble form of a canine gastrointestinal support. So just something to keep in mind as well. And then in terms of where you can get this food, pretty much any major website or company that you would likely direct an owner to, they'd be able to find. And then the website itself also has a home delivery option, which is really useful as well. So pretty accessible. So something that was just kind of fun to learn about in looking at this article. So then moving on to struvite review, specifically for feline patients. We can go to the next slide. So this is just a little graphic I stole from the internet, so I apologize if it's a little grainy, but mostly I just wanted to highlight again, as we know, that stone formation is a process and not every patient's going to form stones, and it can start with supersaturation of certain substances in the urine, crystals as well as other components too. And then even so, we also think there's likely components of what a patient is eating, and particularly cats and struvite stones, right, is what's the magnesium and phosphate level in their foods that they're eating, as well as other various parameters such as the pH of the urine, struvite stones forming in more alkaline urine, as well as the temperature, and then certain other various inhibitor factors that may be absent, or promoters that can take whatever substances are in the urine, help them become supersaturated and form become nucleated and form a nice little nidus for crystalline growth and eventual stone formation. Next slide. So for feline struvite stones and canine stones as well, they're composed of the magnesium ammonium phosphate. And then there can be infectious or non-infectious causes associated with it, but of course in cats we typically see that they have sterile urine when they form these stones, versus in dogs they nearly always will have some urease producing bacteria that we find. And just kind of with that as well, dietary management is a huge component in our feline patients, just as we're trying to limit the amount of particularly magnesium and phosphate that's in their diet. And this might influence even your decisions if you have a dog versus a cat, because in a dog, you're likely treating them for their infection, maybe using the diet as well to support certain, urinary pH goals or that sort of thing. And then once the stone's gone, you may not need that diet long-term in a dog versus a cat. This next slide, just briefly touching on how we typically approach a diagnosis of struvite stones, which can be difficult in our feline patients just because we don't usually have that associated infection. So a lot of times we're using what we know about their history and if they're known stone formers. We might also just kind of use what's known more on a metadata scale, which is kind of the reason I included this graphic on the right. So this was a chart that's a little outdated at this point. I took it from not the newest version of Edinger, but an older one. And it's data that comes from a urinary stone analysis lab at UC Davis. And it's looking at, kind of the trends in which stones they were most likely getting in their reports and that sort of thing. So in general, in cats, we're nearly always diagnosing them with either calcium oxalate or struvite stones. And interestingly, back in the 80s, the primary stone that we were seeing was struvite stones. And then we had a nice little decline in those stones and then a rise in calcium oxalate stones. And now it's considered, a little bit more 50-50 which one you might diagnose, but kind of helpful knowing that going into these patients, if you're suspicious of a stone, these are the two most likely you're going to be diagnosing. And then of course we'll use, other lab work things and imaging as well to help us become more confident in which stone we might be up against in our patients. Kind of, as I mentioned earlier, right, more alkaline urine we associate with the struvite stones, which we also might be able to see some crystals in the urine as well if they have a stone, but it's not always there. And urine culture can be helpful if you're suspicious of bacterial cystitis as well. But of course, as I mentioned, usually these patients will have sterile urine. And then x-rays can be useful too. The study did mention that one of the criteria they had is that they were looking for moderately opaque stones in the urine, in the bladder. So something that can be helpful too, if calcium oxalate and struvites are the two most common we will see, maybe it's even just how radiopaque they are that can help us make that differentiation as well. But it can be tricky for sure. And then stone analysis, always useful, but a lot of times we don't have that going into, the presumed diagnosis of struvite urolithiasis or uroliths. And then treatment options, just in general, the primary thing we're going to be relying on is medical dissolution, and that's true for both dogs and cats. And kind of mentioned earlier, we'll be relying heavily on diet to achieve, a urine pH that's maybe closer to neutral or maybe a little more acidic. You may rely on then urinary acidifiers if you're not achieving the certain parameters you're aiming for, and less likely you'll be reaching for antibiotics in these cases. There are some exceptions, and I'm sure there's, much more out there, but these are just some that I've accumulated from looking through some, papers, things like that, is maybe you're not going to be relying on diet if an owner might be hesitant just for the diet in general, if they have their own, specifications on what they want their pet to eat, or if just in general you find that medications or foods might be contraindicated. And I have a slide about some contraindications for foods in a little bit. Another exception that's been described is if the urolith cannot be adequately bathed in urine. And I guess for me, I think more of, the giant jumbo struvite stones that I've seen sometimes on x-rays where you just don't think that there's going to be enough urine to get all of that surface area and be able to adequately dissolve the stones. and in this paper too, that was one thought too, is, should stone burden be a factor for when we're, giving food to these patients, or in our kind of goals for how long it's going to take to dissolve these stones. And then another exception that's been described is if there's an uncontrollable infection that, despite you using, good culture sensitivity to guide your management, you're still just not able to get a handle on the stones or even the patient's symptoms. So all of those exceptions for medical dissolution may then point you towards surgical removal, and hopefully you're able to get away with something like a minimally invasive approach, like a PCCL, or avoiding urohydropulsion. I think that would be challenging in a cat. I'd love to be a part of, that team that does that for cats, but it seems like it'd be challenging, just based on their anatomy. And of course, if you can't do those minimally invasive approaches, you have surgery, which is less ideal, just since, it's a bit more invasive, but, many options if medical dissolution fails. Next slide shows an ACVIM consensus that came out about the recommendations for the treatment and prevention of uroliths in dogs and cats. And this was a consensus published in 2016 in the Journal of Veterinary Internal Medicine. So this just reiterates that struvites should be medically dissolved as long as, some of those exceptions we've talked about are not present. And in dogs, it's recommended to try to dissolve these stones regardless if they're within the upper or lower urinary tract. But in cats, probably avoid dissolution of upper uroliths merely by the fact that most upper uroliths are going to be calcium oxalate, which will not be amenable to dissolution. And then I just kind of popped in the ISCAID guidelines as well, just to hit it home that medical dissolution is preferred for struvite stones, and you can use antibiotics if there's concurrent bacterial cystitis. These were guidelines that were published quite kind of recently in 2019. So next, moving on to the dietary management of struvite urolithiasis. For cats, it's been described even since the 1980s. And if we can actually go back a few slides, JD, to the diagnosis of struvite stone slide with the graph. So dissolution using diet has been described in cats since the 1980s, and one proposed reason for why we saw this shift from struvite to calcium oxalate from the 80s into the 90s was because we became more aware that we can kind of manipulate the diet and its components to decrease struvite stone formation in cats. And what it's thought is that maybe this actually swung the pendulum towards preferencing a urinary environment for calcium oxalate stone formation. And so now I think it's interesting to find that a lot of the diets that are prescription foods for urinary stones, things like that, will have one component that says, hey, this is going to be for promoting struvite dissolution. And then it's also going to have a function to prevent or decrease the likelihood of struvite stone formation and calcium oxalate formation. So maybe now the goals wouldn't be necessarily having a pH that's very acidic for a known struvite former, but maybe more of a neutral pH. So we can pop on back to then the general nutrition goals. Yeah, perfect. So this was a veterinary clinic's small animal practice article that I found quite helpful just in kind of establishing the general nutritional goals that we have for these patients. One being, what's primarily thought to be very important is urine dilution. So, the importance of this in trying to stimulate diuresis in these patients is that we think it's going to overall decrease the concentration of certain precursors for these stones and to stimulate more frequent urination, just offer an environment that's less conducive for stone formation. And it's thought that this urine dilution and diuresis should be really only seen if you're achieving a diet with a moisture content of greater than 70%. And I don't know how many of you have dove into the depths of nutrition on labels and things like that, but I definitely got lost down in a deep rabbit hole. And I found it a little bit difficult to know what the exact moisture content might be on food and on the bag and the label. And someone can for sure point it out to me if I just missed how to read it, but it can be tricky, I think, for vets and certainly for owners. I feel like if they're trying to, have a say in what their pet's eating, is the moisture content and how nutrients can be described can be either on an as-fed basis, which would be inclusive of the moisture content, which can be water plus other volatile substances, or it can be a dry matter basis. And in a lot of the foods I was looking at said dry matter basis, and I frankly had no idea how to get to see what its moisture content was. But what this article described too is that in general, it's accepted that by adding about 1.5 cups of water to 1 cup of kibble, you'll get about an 80% moisture content in the food. So obviously something we're transitioning these patients to slowly, but just something as a general guideline. And then for various reasons, if you find that you just can't get your cat to eat that kind of a new stew in their kibbles, you can try to add sodium or increase the sodium content. It's just not as preferable, just in case there's maybe other conditions that you're worried about, cardiac disease, kidney disease, that sort of thing. Urine pH is another general goal. We've talked about a little bit, trying to promote instead a more acidic environment. And just a little plug that I found interesting as I stumbled upon what's called the postprandial alkaline tide. I don't think it's super substantiated in either the veterinary field or human medicine from what I could find. And if anything, I think it's more controversial from the read air papers I was finding. But I thought it was worth mentioning that the thought is that, hey, in association with eating a big meal, the body's going to release more acid in the stomach, which, to break down that food, and in downward stream, we see a more alkaline pH of the blood, which can then cause the urine to become more alkaline. And so the thought is that maybe in these patients that are stone formers, you don't give them 2 big meals, but instead smaller meals throughout the day to prevent that fluctuation in the urine pH. And I found at least one study, I want to say it was from maybe 80s or 90s, that looked at that and said that it made an effect if you changed it, but I don't think it's really been looked at since, but interesting nonetheless. Dietary precursors, as I've mentioned, another nutritional goal, trying to decrease the magnesium and phosphate content in the food. And even so, it's even the type of magnesium that you're trying to alter in the diets, not necessarily even just, magnesium itself. And then on average, from other studies that have been done in foods that are known, about 30 days is the typical time that we expect these stones to dissolve with diet. So contraindications from using the diet, some of these have been mentioned. Maybe your patient has a food insensitivity, and not all these diets, I think maybe there's one, if I can remember, that has like a hydrolyzed component plus promoting good urinary dissolution or stone dissolution. Some describe that, maybe you're worried that by how big the stone is or how small it's going to get as you're trying to dissolve it, will that cause a urethral obstruction? Maybe it's worthwhile to still start it if you're worried about it, in these patients. And if they do obstruct, then you rely on your more surgical interventions. These diets are not suitable for growing kittens, pregnant, or lactating queens. And then, as I've kind of touched on, there's some debate about the higher salt content in these foods for patients with like cardiac or kidney disease. And in people, they'll mention, these diets are concerned for potentially patients with hypertension. This next slide is just some of the diets that are already out there, and I included blue buffalo on there now since it's, a no food that we can consider. And for sure, it's not all encompassing, and there's tons of different flavors, things like that for all these foods. But at least these are what's most, available in the States for like a veterinary prescription standpoint. And then on the next slide, it's just kind of a fun little quick cost comparison that I wanted to give you for between these diets, and just to show really that, and these are in American dollars, obviously. And then blue buffalo is pretty, reasonably priced compared to all these other foods. They all didn't have the same size bag, which was difficult to kind of get a good estimation, but, it's not an exorbitantly more expensive food, even though it's a bit more of a boutique brand, I would say. Next slide. And then I just generally wanted to touch on, RSS and some other labelings that you stumble upon, because I just felt like, I was seeing all of these abbreviations and then all these symbols, and I just wanted a good understanding of what these meant on the label. So next slide. So RSS, or relative supersaturation, as we know, is an in vitro method that's trying to look at what might be happening in vivo in patients in terms of ability to either form or a stone or dissolve it. And so the RSS, right, is going to be how likely a substance is going to precipitate in the urine, and it's using computer calculations. It's looking at a bunch of different solutes, things like that, and using urine parameters like the temperature, pH, to try to come up with a number that's going to tell you, hey, is the urine going to be undersaturated in a metastable zone or supersaturated and likely to form a stone? And in general, right, you can have different RSS values for different stone types, as this graph shows. But in general, we're trying to get a low RSS value for hopefully, a full 24-hour period, so that we keep these patients in an undersaturated zone so they don't have a stone that precipitates. Next slide. Activity product ratio. I kind of just only saw this in really one, I think, area I was reading about, and it's just kind of similar to the RSS, but it's another in vitro method at using computer programming to try to predict the likelihood of, a stone forming. It just uses a little bit different parameters to make this judgment. It involves incubating what I can tell, like part of urine or something like that, with a seed crystal of the urolith type that's being evaluated. So not as frequently relied on as the RSS, but some abbreviation I was running into. And then next slide. So all of these ones with like the SO index, S+Ox shield, these are all from the major companies themselves that are just identifying like, hey, this is a prescription urinary diet, and here is the goals we're trying to achieve. These symbols don't mean the same thing for every food, even within a company. And so the best advice that I found is just looking at the label and trying to see what goals a specific food has. In general, most of them are going to be achieving low RSS values. They're going to be either promoting dissolution of struvite stones, and if not, trying to prevent struvite and calcium oxalate formation. The pink one in the upper left corner, that's going to be from Purina. The SO index is going to be Royal Canin. The S+Ox shield in the lower right is Hills. And then the cleverly named Stone Guard is Blue Buffalo's now, label to identify these foods. So then, just in other words, the RSS and APR were developed as a way for diets to target stone prevention and dissolution. And, all these major companies have just had these marketing techniques to help us know what the goals of this diet has with regards to struva or stone management. Cool. So then back to today's article, all of that kind of circling around back to this article again that came out in 2021 in JFMS. It's looking at these blue natural veterinary diet, W plus U weight management and urinary care food. It does come in a kibble and can form, and it has a weight loss component to it as well, because it's thought that, overweight patients are going to have an increased risk for urethral obstruction, and potentially if these patients are overweight, they're going to be eating more of food that just may have more calculogenic substances, and so that could contribute to stone formation. And interestingly, it was shown in this study, at least, that a good majority of their patients were indeed overweight. This study, as I've mentioned, with all of the other prescription diets, did have a pre-marketing study that looked at cats that were healthy cats and not known stone formers, but they were aged 2 to 14 years old, and there was 10 cats total in the study, and they were fed the diet exclusively for 23 days prior to urine testing, and it was shown that at least in these cats, it maintained an RSS value of less than 1 for struvite formation and maintained a urine pH of 6. The diet itself is chicken-based and grain-free, and then I just thought it was fun to include the magnesium and phosphorus amounts that this diet has, and then kind of compare that to the AFCO minimum recommendations. And so they do have enough of these substances, they're just going to be reduced compared to your kind of over-the-counter foods. The main objective of this study was to determine the efficacy of a low struvite supersaturation diet in dissolution of feline struvite cystoliths. The investigators hypothesized that by exclusively feeding this diet, there would be complete radiographic dissolution in less than 56 days. And again, we typically expect these stones to dissolve in about 30 days, so a very reasonable time frame to think about. These were client-owned cats, and they were recruited between the time frame of December 2017 to 2019. And any cats of either sex or breed were able to be recruited, and they were recruited if the referral veterinarian had suspected Struvite uroliths. These cats then underwent a screening phase where they got full exam, lab work, urine testing. They had aerobic urinary culture and then 3-view x-rays. And then if they passed the screening phase, they were then enrolled in the studies based on the appearance of stones on x-rays. Again, the study was looking for stones that were moderately opaque and then round or discoid in shape. And then the urine parameters was looking for a urine pH of greater than or equal to 6.5. Of note, clinical signs of lower urinary tract disease did not need to be present in these patients, but interestingly, all of them at least had one, if not multiple, signs of lower urinary tract disease. And then these cats were exclusively fed the diet, the blue buffalo diet, for the duration of the study, and they were told to be strictly kept indoors. And I thought it was really nice that if it was a multi-cat household, that enough of the food was supplied for all of the cats in the home. And then the cats were also told to either, be immediately transitioned to the diet, or they could have a transition phase over a week. And it was kind of up to owner and clinician preference in terms of how quickly that transition occurred. During the study, the owners were also asked to keep a daily log where they, wrote down various things like how much the cat ate, if they ate anything else, and then any kind of GI upset that may have occurred. And then these cats got evaluated every 2 weeks after that, once they were fully transitioned to the food, another physical exam, urine testing, 3-view x-rays as well. And then if the cats did not dissolve the stones fully after 56 days, the study design was to have surgery to remove those stones to see if there was something, a different component to the stone that wasn't going to be dissolved. And as we know, right, a couple cats did fall into that category, which we'll talk about in just a little bit. So for statistics, it was using good gravy, two-tailed paired t-test, and the significance was set at less than 0.05. Pretty reasonable for this study and what it was looking at. And then in terms of the results, there were initially 19 cats that were screened for inclusion, but 3 of them were excluded for various reasons. The median weight for these patients was about 6.15 kilograms, and they were, I think it was majority of, or 10 of them were considered overweight. Most of them were domestic short hairs, most were females, and then the median age was about 5 years. And again, all of them had at least one clinical sign, if not multiple, of lower urinary tract symptoms, hematuria being the primary one. And then during the study, 3 cats were removed just for various reasons. And I think I chuckled to myself when one of them ate a donut, of all things, from a family member, which I honestly was just impressed that a cat ate a donut, because I wouldn't have expected that. So then further results on the next slide. So this is now of the 9 remaining cats after the 3 were excluded for the various reasons. So of these 9 cats, by day 14, 22% of them, or 2 of them, had complete resolution of their struvite stones based on x-rays. 56%, or 5 of the 9 cats, did have resolution by day 28, and then 78% of the remaining cats, but all of the cats that did achieve complete resolution had resolved their stones by day 56. 2 of the remaining cats did have partial resolution. 1 cat that had resolution by day 70, the owner didn't want to do cystotomy, and so the diet was continued to be fed. And this cat had a pretty large stone burden, which maybe was playing a role into why some delay in that dissolution was occurring. And then another cat had a cystotomy because it had actually a calcium oxalate at its core, which on the next slide is just showing the x-rays of this cat. So it's actually pretty cool. You can appreciate it on the screening x-ray on the left, where it does look like there's a more radio-opaque core, and then on the outside is the stone that was able to be dissolved, and then on the right we see the stone that was kind of left. And Depending on where you look, I saw some numbers even from 3 to 5.5%, or even up to 11% of stones will be a compound stone. So meaning they have something different at its core versus, near the outer shell. So something always to keep in mind, right, as we're trending these patients and you are achieving some serial dissolution in their stones, but suddenly you just kind of become at a plateau, maybe start considering, hey, this might be something else that we're trying to work with now, and it's no longer struvite. This next chart is just some additional way to look at some of the main results from the study. Interestingly, the USG was not found to be significantly different from the screening phase to the average time of dissolution for these patients, which the paper talks about, maybe it's not as strong of a goal that we need to have in these patients if we can still achieve dissolution. The change in pH was found to be statistically significant, and so starting right more around 7, and then average around 6 by the end of the study. Again, the main sign that most patients had was hematuria, whether that was macroscopic or microscopic, and then none of the cats had macroscopic hematuria at the time of dissolution. And then for crystalluria, only a couple of them had some kind of crystals that were in the urine on screening, and none of them had crystals noted at dissolution. And one cat was found to be positive for E. coli, but no cats had a positive culture at time of dissolution. On this next slide, I thought it would just be fun to kind of see, okay, well, it seems like this diet worked in this study, so how does it compare to the diets that maybe you've relied on in the past or are a bit more familiar with? And overall, this food looks really comparable to the dissolution time that other diets have shown. Of course, Hill's SD is going to be one that achieves dissolution quite rapidly and is not meant for long-term maintenance in these cats. But important to know too, some of these times and dates from what I could find are more a median time to dissolution versus average time, but regardless, I think the blue buffalo food still had a really reasonable time to dissolution for what this study showed. And then for a 6-month follow-up, 8 of the 9 cats were still eating the diet, and most of them were free from lower urinary tract signs. One cat had an onset of clinical signs, but I think was more lost to follow, couldn't really elaborate on it further. And I wasn't able to find how this compared to some of the other diets that we'd known, just in some of the studies I was finding in terms of like, how long are these cats eating the food, and what do their clinical signs look like? But overall, really nice to see that. And then finally, just talking about some limitations that the study mentioned, and then just kind of, picking up on it as reading it. It was an unblinded study, and it was uncontrolled, so it'd be interesting, but understandably very challenging to design a study that's going to have all of those components. The stone type wasn't known going into recommending this diet for dissolution, but seems very reasonable that they were right and that it was a struvite stone, since especially most of them responded to dissolution diets as well. I mentioned about the one cat that had a large stone burden, and there haven't been a lot of previous studies showing, should we take this into effect if there's a lot of stone versus one giant stone that we're trying to dissolve. And then x-rays versus ultrasound were used, and maybe there's going to be some debris and things like that we would pick up on an ultrasound that the x-rays wouldn't share with us. And so although we're saying, hey, they're completely dissolved by this day, maybe there's still a little bit of grit or material that would be around. But for the majority of them or all of them not having clinical signs, I think kind of depends on if it matters or not. And then possibly we were underestimating the time to dissolution, just, if some cats didn't need to be transitioned as quickly as some other cats, or they had a weak lag in that transition phase, maybe we were underestimating the overall time to dissolution. And then pH was measured by a test reagent strip, so it might be more inaccurate than some other methods that we can use to measure pH. And then this is just mostly like my discussion questions if no one had any thoughts or anything to share immediately. So certainly can open the floor to questions or thoughts and comments. And I feel like I maybe talked a little fast, but hopefully, yeah, we have some things to chat about.
Great. Thank you so much, Courtney. That was really fantastic. Just looking at the chat, Joe had mentioned a little bit about information on the labeling versus
Oh,
just
yeah.
trying to get the moisture and other content, that it's a little bit more challenging, but the information can be figured out eventually. And I think maybe I don't know if it's like on their websites that I've been able to find the moisture percentage, but
Okay.
it's always been annoying to me, like what
Yeah.
find easily versus when I have to try to dig up the PDF file of the feeding guide to actually get the nutrients on an as fed basis.
Yep. Yep, for sure.
So I personally can't say that I've used this Blue Buffalo diet. I would imagine that some of our attendees have used it, since some of the authors of the study are in here as well too. And just didn't know if anybody else had comments or experience using the diet. Particularly the grain-free aspect. I know certainly the complications in dogs and potential connections with DCM have been put out there. And I don't know, and I don't know if Joe or anybody else might comment on if there are similar concerns with grain-free diets in cats, but I guess in general, I tend to avoid them, and maybe I don't need to, and I need to investigate it more. But it makes me a little nervous that it's grain-free, but I don't know if anybody has comments on that as well too.
Hey, JD.
Yeah.
Hey, it's Joe. So that's a whole different discussion, especially given the actual lack of proof of a correlation. But in the data in cats, there were very, very few cats that have been reported on grain-free diets with cardiomyopathy. So I think it's not as much of a contentious issue. I will just throw out and then piss some people off that even the association of grain-free with dilated cardiomyopathy in dogs is pretty not correlated, pretty not definitively shown, and there's a lot of potential reasons for that, but that's a whole different discussion.
Great. Thanks, Joe. Based upon Jody's study looking at SD and CD, which I think you folks had maybe 37 or 39 cats that went through that study. It's typically been my recommendation when we're seeing these cats to initially prescribe them SD to try to get the fastest dissolution, and then from there switch them over to something that is going to be a better preventative. And we'll frequently see cats that are coming in obstructed due to urolithiasis, male cats. And I still recommend to our emergency service to try to just push the stones back into the bladder. They obviously didn't show up the morning of the obstruction. They'd been there for probably weeks to months before that. And if we push them back into the bladder, start the diet, we might be able to cross our fingers and hope that we'll dissolve them before there could be another reobstruction. And we've had one or two patients who have had subsequent obstructions, and we've done PCCLs to remove what is really kind of a bunch of sand and debris in their bladder. But we also have a lot of those cats who go on to not come back and have successful dissolution of their stones. And so we're still recommending to dissolve them even for male cats. And I know that they had one of their 3 cats that were male who ended up going through the study have an obstruction. But just wondering how frequently other people were experiencing that, or are you hesitating on recommending dietary dissolution for male cats for that fear of obstruction? In my experience, it's not a frequent finding, but I do warn owners about it.
From the ECC side of things, at least where I've been at and where I'm at now, we tend to go towards removal of the stones rather than attempting dissolution in these blocked male cats. Some of the discussion comes with the owner. They're often spending $3,000+ for a UO stabilization and treatments, and the risk aversion of not wanting to have to go through that all over again. if the stones pop back into the urethra, become a stumbling point for them from a financial perspective. Although the cost of a surgery costs the same as another UO obstruction episode sometimes. So it might depend on a couple of different client-related factors as well.
Sure. One thing that I've always wondered is for these cats who reobstruct because they have a urethral that I just wonder if we could potentially sedate them, unblock them, push the stone back into the bladder, empty the bladder, and then pretty much leave them on their way. I just feel like they're probably different than the cats who have urethrospasms, the sludge, and just a different material. If it's a stone, then if we retropulse the stone back into the bladder, do those cats need to have a UCath in for the next 36, 48 hours? I don't know, maybe not, compared to those cats with obstructive interstitial cystitis and debris and a urethrospasm. I just wonder if maybe it's a different disease and maybe we can treat them a little differently. I don't know. Jody, what do you typically recommend, or are you seeing them reobstruct? Do you make any recommendations?
Yeah, so we tell them that if they come in obstructed, that there's something unique about this cat, and you probably are better off going to surgery. But we do have some owners who wish to try dissolution in general, and we'll go ahead and do that. And if they do come in obstructed, then we would unobstruct them and then take them to surgery. So yes, so once they have a urethral obstruction, whether it's a dog or a cat, we generally push them more toward going to surgery and removing the stone.
And in your paper, Jody, sorry, I can't remember off the top of my head, did you folks see cats developing urethral obstruction during the dissolution time period when you were comparing SD and CD?
Yeah, so the answer is usually no. So we didn't see any in our study, and when I looked at all the studies of these cases where they're dissolving stones, this one is the only published study that said that there was actually an obstruction. None of the others did. And then there was an abstract that was presented that I have not seen the study come out yet, where they said they may have seen one. So there's about 130 animals who have been through these dissolution studies. Maybe only a third to a half are male. And out of them, with this study and the abstract, it's been 2 out of that group.
I'll be honest, when we put this study together, we didn't think obstruction was going to happen for exactly the reason that Jody mentioned. I mean, we were like, oh, you never see them obstruct when you're dissolving the stones, We're like, oh, that's not going to be a problem. Because once the stone, in theory, especially if you see the amazing video that Jody has of creating and then dissolving struvite stones, if you can get the pH down enough, they're going to dissolve fast. I mean, these dissolve quickly. It's not like it's not like urates that take ages to dissolve, or like a staghorn or something. I mean, they dissolve very quickly. And so we really were shocked when that one obstructed.
Yeah, so it appears rare. I did have one question though, and how long should a diet be fed for we to say that it prevents disease? And I'm not sure what that is. I think 6 months may be too short, but probably in our experience, we don't see recurrence of stones of feline struvite for about 2 to 2.5 years.
And is that on commercial over-the-counter diet, or was that on a preventative diet?
On anything. So what our data says, even looking at the Minnesota Urolith Center data, cats usually don't, at least they don't have a reported stone recurrence for about 2 years.
And Julie, I think you folks comment on it a little bit in the discussion, but since there was no significant change in the specific gravity and a mild change in the pH, which you also wonder, since it was so few cats, if the how much of an effect could be there. You folks really thought it was just due to the difference in the calculogenic materials that were in the urine as a result of diet. That was the main reason that the stones dissolved. Is that right?
I think the pH also does have something to do with it. I'm wondering if and this is something, Jody, you probably know much more about this than I do. Well, I'm sure you do. Is that in dogs, it seems like if you get them down to a pH of 6.5, they will not have struvite stones. But we had cats with a pH of 6.5 who had a bladder full of struvite stones. So I wonder if in the cat, its pH is still important, but there's also a different amount of calculogenic or lack of inhibitors going on in there.
I'm not sure we know the right answer, but you're right. It probably has to do with their nutrition, meaning that we usually give them more phosphorus and magnesium in their diet. Again, there are other people who are nutritionists here, and pH probably does play a part of it, because certainly you're right. pH will really change the composition and conformation of struvite very easily, and you're also right that specific gravity doesn't seem to matter as much as pH and maybe the nutrition that they're putting out in their urine, the magnesium and phosphorus.
I would also say that because you were using dipstick pads, not a pH meter, means struvite, the break point's right around 6.8 pH. And so your 6.5 could be within the error of using the pH strips rather than a pH meter. So I think that's the thing to keep in mind.
Yeah, that was one of the unfortunate issues with this, is that I literally like was begging people to use their pH meter, and it just didn't happen. And but you know, and as it always seems to happen whenever one of us starts a clinical trial, as I'm sure most of you are aware, the second that you start doing one of these studies, the cases dry up, right? We don't see very many struvite cases in our internal medicine service because referring vets manage them. And I don't know if that means that we've done a good job of training our graduates that they should try a dissolution diet first before they send them into us to deal with, you know, calcium oxalate stones, or that everybody's just really good at doing cystotomies or whatever in the area. So I literally never see a struvite case in our referral service. It's almost always either sent right in through ER because it obstructed for some reason, or it's usually just dealt with by the referring veterinarian.
Yeah, we end up seeing them mostly because we're the medicine service does the PCCL, so that's our hospital is actually pretty good at saying, well, if you need to get stones taken out, you should do a PCCL rather than a cystotomy if you can't do voiding hydropulsion or stone basketing. So we end up getting involved mostly because we know how to put the trocar in the bladder, really. But they don't come to us very often as primary consults, that's for sure.
And yes, the cat did eat donuts. The mother-in-law was feeding the cat donuts. Apparently, the cat loves donuts, and the owner was rather sheepish when they finally admitted it.
That's hilarious. That's so good. And just some comments from the chat as well too. Andre had said that you know, they kind of have the same approach in Brazil if they have a block cat, depending on what they're able to do, if they have enough money for the dissolution diet versus taking them to surgery to deal with the chances of reobstruction, as Jethro was saying as well too. And Kelly had mentioned that her experience out in specialty private practice is the same, seeing more so recurrent oxalate stones way more than struvite. So they are fun when you see them. And I love the dogs who come to us for stone removal when they're huge struvite stones and nobody thinks that we can dissolve them in, and we can. Those are super rewarding for everybody involved. So, but yeah, I would agree. I think oxalates are the ones that we deal with way more commonly in general. Great. Well, I think if there are any other comments or questions, otherwise we've come to the end of our hour, and I really want to thank Courtney for putting the presentation together. Excellent review of urolithiasis in general, as well as looking at this data and the data from the other studies. Thanks so much for putting this together. Really appreciate it. And thanks everyone for attending. It's been fantastic. I think our next session that's scheduled is in June, maybe the 18th, somewhere around there. Don't quote me on that, but I'll send out an email. And then obviously, if you are interested, please don't hesitate to sign up to present at a session. It would be wonderful. There are plenty of open sessions left throughout the rest of the year. And of course, I'll include the link on the email that I send out. So thank you so much, everybody. We'll go ahead and close the session for today and look forward to chatting with you again at the next session. Thanks again.
Thank you so much.
Thanks, Courtney.